Hello and welcome to Mito Canada's Exercise as Medicine for People Living with Mitochondrial Disease. This is the third session in our three-part spring education series. Before we begin Dr. Tarnopolsky's presentation, we'd like to share a little bit about Mito Canada with you. Mito Canada is energizing lives. We dedicate every day to creating a world where all lives are powered by healthy mitochondria. The goal of our charitable organization is to support those living with or at risk of developing mitochondrial disease through education, awareness, research programs that enhance the understanding of mito and improve quality of life. We'd like to thank Louise Gibson and all those who participated in the 2021 Walk and Roll for Mito. Funds raised through this event made this presentation possible. We appreciate Louise's vision, the dedication of all participants, and the support of our donors. During this presentation, Dr. Tarnopolsky will explain how exercise can improve strength, endurance, and quality of life, especially for people living with mitochondrial disease. Dr. T will explain how different exercise benefit those with mito, how to manage exercise after setbacks and illness, and important exercise do's and don'ts for our community to keep in mind. Dr. Mark Tarnopolsky is a professor in the Department of Pediatrics, the division head of neuromuscular and neurometabolic disorders at McMaster University, and the founder and CEO of Exerkin Corporation and Stay Above Nutrition. Dr. T holds a chair in neuromuscular disorders from McMaster Children's Hospital and Hamilton Health Sciences Foundation, and is recognized as an international leader in researching neuromuscular and neurometabolic disorders. Dr. Tarnopolsky's innovative research is focused on mitochondrial disease, as well as muscle disorders and other neurometabolic disorders. His goal is to discover and evaluate therapies and treatments for people who are living with neuromuscular diseases, mitochondrial dysfunction, and other mitochondrial conditions such as aging, immobility, diabetes, and obesity. So now that you've been introduced to our expert, let's start learning. Welcome, Dr. Tarnopolsky.
So today what we're going to talk about is how mitochondria can energize our lives. Obviously, people with mitochondrial disease have mitochondria that have some form of dysfunction, and there are certain ways to try and improve mitochondrial function, and exercise is one of them. We're going to talk about how exercise can benefit mitochondria and overall health. And in general, there's two main types of exercise. One is called resistance and the other is endurance. Resistance exercise, you're probably familiar with lifting weights. That can be with machines, free weights, and other things which we'll talk about, or using things like TheraBands, but even getting up from a chair, going up a flight of stairs, all of those things are forms of resistance exercise. And then endurance exercise is generally considered things like walking, running, cycling, elliptical, those type of activities that are for a longer duration, but less intense. And both of these, can be used by patients with mitochondrial disease and have both been shown in studies to be of benefit, but we've got to know how to do that properly. And hopefully that's what we'll talk about today. So today we're going to talk about how do you get started with exercise. It's sometimes daunting or challenging for people. And sometimes people with mitochondrial disease have avoided exercise because, they were in a gym class, they didn't know they had mitochondrial disease and maybe were pushed too hard and could have even had serious outcomes from exercising. But we can avoid that if we exercise safely, and we'll show you how to do that. The other challenge too is how do you stay on track? For able-bodied people, the success of continuing to exercise over a long period of time drops off dramatically. People just don't become compliant. They say they're too busy. And there's various tricks that can be used to help people stay on track, and we'll talk about some of those. The other thing I think as well is for an able-bodied person without mitochondrial disease, there's lots of benefits from exercise, but they're kind of ephemeral and you don't really notice them. Whereas with different neuromuscular disorders, mitochondrial disease, we've recently published a paper in myotonic dystrophy showing significant benefits, mostly at the mitochondrial level, which improves the quality of life. And it's much more impactful for people who have neurolocomotor disability to realize the benefits. And that sometimes gives them motivation to continue. And we'll talk about, some very special considerations for people who have mitochondrial disease, to try and avoid damage from exercise, which can occur if you push too hard or there's other circumstances we'll talk about. So mitochondria, people I'm sure in this call are very familiar with the fact that energy is produced by mitochondria. There is a process in our cell called glycolysis, which can produce energy, but it's very inefficient. Mitochondria are much more efficient at producing energy. And in fact, 1.5 billion years ago, we accepted the mitochondria to have a sort of a symbiotic relationship with us. And we've continued that throughout evolution such that every human being, every mammal has mitochondria. And these all started 1.5 billion years ago, where we took on the mitochondria to detoxify oxygen and to better extract energy. And since they did such a damn good job, we've hung on to them and we've kept these little beasts inside us throughout evolution. In fact, mitochondria are present in every cell in our body, with the exception of your mature red blood cells. And it's essential for mitochondria to produce energy for all tissues. But when it comes to exercise, of course, muscle is very important, and muscle energy can vary dramatically. So when you're sleeping at night or resting in a chair, your muscles are deriving very little energy because they're at rest. You can increase energy use by muscle up to 30-fold with high intensity exercise. And it's that rest to exercise transition where many patients with mitochondrial disease feel the symptoms because the mitochondria can't respond to generate energy. But certainly with exercise training over time, the muscles do a better job, and that threshold for getting those symptoms of shortness of breath or muscle pain are higher, and you can tolerate more. We know that we've accepted these mitochondria in all of our cells, and therefore, since we have trillions of cells, we have trillions of mitochondria. And these little beasties are in every cell, and they're constantly moving. So what they do is they fuse together, they split apart, and they constantly respond to the daily energy needs of every cell in our body. A number of tissues, our brain when we're thinking, our heart, which is constantly pumping, and our muscles are very enriched in mitochondria. And that's why patients with mitochondrial disease have symptoms that affect these organs. So if it affects the brain, things like strokes and seizures and cognitive impairment can occur. With the heart, people can get what's called cardiomyopathy, which is an enlargement of the heart and it doesn't work properly. And of course, with muscles, you can get exercise intolerance or fixed weakness or a combination of both. So mitochondria, when they work well, can respond to things like exercise and good nutrition, where we increase either the number of mitochondria, that's called the mitochondrial abundance, or their function. When we talk about function, that means per individual mitochondria, they're more efficient. When we exercise, generally what we do is we make more mitochondria. So per cell, you get more engines, and therefore for any energy need, you've got much more engines there, more energy potential, and therefore it represents a lower proportion of the total energy. Mitochondria, as I mentioned, evolved for the last 1.5 billion years, so they're very, very efficient. And in healthy individuals, the efficiency of the mitochondria are pretty much already maxed out. In mitochondrial disease, when the mitochondrial function is not working well, we can get both an increase in number and an increase in the individual function per mitochondria. So mitochondrial disease can either be impaired mitochondrial function per mitochondria, so they just don't generate enough energy, or there's disorders called mitochondrial DNA depletion syndrome, where there's just fewer mitochondria. Both of these can benefit from exercise to both improve abundance and the function. So exercise, and we have here, is good for almost everyone. There's very few situations where exercise is not good. I almost can't think of any. And there's a number of benefits of exercise. So in mitochondrial disease, in Duchenne dystrophy, in myotonic dystrophy, and in aging, for example, which is a mitochondrial disease that we all have, exercise, we and others have shown, is beneficial. And there's a number of reasons why it's helpful. Even if you don't increase your mitochondria or your energy supply, just by increasing muscle strength, there can be benefits. So very weak muscles, people are more prone to tripping and falling. to their knee buckling and may rely on assistive devices. When knees and joints, muscles are weak, it can sometimes put more stress through the knees. So for example, yesterday I saw a patient who had a muscle disease that affected their quads. They were so weak that the only way they could walk was to snap their knees back. And over 30 years, it caused severe degeneration in this lady's knee joints, and they had to be replaced. So definitely stronger muscles help with your joints as well. We know that if you improve your muscle function, the number of mitochondria that you have, your energy and stamina go up, and that's just pretty simple physics. When you have more mitochondria, you have more energy. It can improve brain health. Now, years ago, people thought, well, exercise is good for my heart and my lungs and my muscle, but what does it do to my brain? Probably nothing. But about 20 years ago, it was quite clear that when we exercise, the memory part of our brain called the hippocampus, we actually get new cells that are formed. So we actually get benefits to the brain. The antioxidant potential of the brain goes up, and what's called the hippocampus is where we first lay down memories. Those cells actually increase in their abundance when we exercise. Next, another benefit is helping to maintain a healthy weight. The problem is that people don't move very much. They don't burn energy. And if you don't burn energy and you take in more calories, it's just a net balance issue. More calories eventually get turned into fat and people gain weight. And when you gain weight, it makes it harder to get around. So if I took an able-bodied person and put a 20-pound backpack on them and said, get out of a chair, they'd find it difficult. Going upstairs, they'd find it difficult. And we have many patients where we find that because they're not moving very much, either from a muscle disease or mitochondrial disease, they don't burn much energy. And even what seems like almost nothing that they're eating, they're still gaining weight because there's more calories coming in than what they're burning. And therefore, if you can burn more calories by doing exercise, you can have a wider repertoire of foods, enjoy eating more healthy foods, and maintain a healthy weight. The downside of excessive body fat is that it increases your risk of cardiovascular disease, increases your risk of diabetes. And people with mitochondrial disease, especially MELAS syndrome, are already at high risk for diabetes. So we want to try and mitigate this weight gain. Now, some of you may look at patients with mitochondrial disease, or you look at yourself and you say, well, I'm not overweight, I'm actually super skinny and I'm very thin, something that we call cachexia in the medical literature with people who are excessively thin. However, when we put people on a fancy machine in our clinic, which measures exactly how much body fat and muscle mass, what we find in a number of our patients, both mitochondrial and muscle disease patients, is that their muscle mass is very small and their body fat is really high. So when they do a body mass index, which is what most family doctors and doctors use to measure whether you're obese or underweight, everything looks great. But when you actually measure the body fat, there's much more than expected. So again, another benefit of exercise. We also know that exercise can help to maintain blood pressure. Now, when you acutely exercise, you've got to be careful. So with high intensity weight training, for example, which would be rarely done by most patients, it can increase your blood pressure transiently. So if you've been shown to have a thing called an aortic aneurysm, or you have very high blood pressure, you'd want to avoid higher intensity activity, and definitely don't hold your breath when you're lifting a weight. But most weights can be lifted safely and derive benefits without having to strain and push really hard, which we would tend to avoid. Interestingly as well, there's evidence that exercise can reduce anxiety and depression. I won't get into the mechanism, but it's actually been linked to mitochondrial function. So through improved mitochondrial function, there's a vitamin B metabolite called kynurenine, and that gets favorably influenced by exercise to help reduce anxiety and depression. And I think, most of us probably know that when you go for a nice walk, you've gone for, a bike or whatever it is that you enjoy, and you come back, you certainly feel more calm and more upbeat. Certainly, I know myself when I've gone for my bike or my run in the morning, I'm much more relaxed at work. I feel much better and more enthusiastic. And all of this is by increasing your mitochondrial function. So we do know that improved mitochondrial health has been shown in older adults to affect pretty much every part of our body. So when we take an older adult who has mitochondrial dysfunction just from aging, and we start exercising, there can be benefits to pretty much every organ. There's improvement in skin health, and we published that in 2015 through a compound called interleukin-15. Liver, pancreas, and gut are favorably enhanced. Bone is strengthened with exercise. So certainly with more resistance exercise, there's benefit. And we and others have shown that mitochondria are important for bone health. Muscle, we've talked about that. That's logical. We get more capillaries, which deliver more nutrients and oxygen to the muscle. There's an increase in the oxygen delivery to muscle when we exercise. So there's more red blood cells. And the heart is favorably enhanced. So although the heart can thicken a little bit in top sport athletes, we don't see that with regular exercise and with therapeutic exercise. What we see is that the heart is better able to pump blood, and there's better exchange at the lung level. And we've already talked about the benefits to the brain. So how do you get started? I think the first thing, especially in patients with mitochondrial disease, is you just should make sure that you have your heart screened. What we mean by that is to have an ECG to make sure there's no conduction block, and to have an echocardiograph to make sure that the heart is not enlarged. Even if those things are there, you can still exercise, but you need to just have certain precautions, and I would make sure that those are checked first. People with cardiomyopathy, which means an enlargement of the heart, the therapy that the cardiologist gives them is exercise therapy. So it doesn't mean you can exercise, but it's good to know about it because there's other medicines that you'd want to be on to help to improve your function. So it's important to take time to plan exercise, start off slow, gradually improve, and also to have some goals for yourself. So, pick a goal, whether it's, you say, I can only walk to the store for 5 minutes without stopping. And maybe your goal is to walk the full 10 minutes to the store. And that might be a goal in 2 or 3 months that you're trying to attain. So create some goals because it gives you something to think about and to work towards in the future, and it helps to keep you compliant. And also those days when you don't want to work out, you say, geez, I really want to make it to the store without stopping halfway. And so I want to, go down to the gym and make sure I do my workout. It's important to take time for yourself. So reserve the time and block it off. I can tell you for sure that if you say, oh, I'll just fit it in sometime later on in the day, it's not going to work for you. Find a time, find a slot that works for you. Now, I just can't imagine my life without getting up at 5 in the morning. And it's so wonderful to, get the exercise done. And then it's like, okay, the rest of the day, I feel fantastic. There's no stress about having to fit it in. There's no anxiety about me having to work out later. And is some patient going to keep me into my time for myself to do my exercise? I think it's important. I think COVID has shown us that, get the equipment that you need, either if you've got a gym in your building, if you live in a condo, for example, or a YMCA that's nearby, or if you feel more comfortable getting equipment at home. It was hard during COVID because everyone was buying home equipment, but it's getting a little easier now. You probably saw the Peloton bike craze take off, but certainly things like what this gentleman's on here. This is a stationary bike, good quality stationary bikes you can pick up for around $300. They're quiet. The nice thing about a bike is you can watch TV and use other tricks like, watching your favorite Netflix film only when you're on the bike, keeps you compliant. Always important to start slowly. So we just published a paper this week in a journal called JCI in myotonic patients who have severe mitochondrial dysfunction. And we had one lady who started our exercise program on a bike like this with zero resistance. She lasted 38 seconds. At the end of our 3-month training session, she was coming in 3 times a week for 35 minutes at 65% of her maximal heart rate. Now, of course, if we tried to do that off the bat, she would have tanked and never been able to do it. But we started off slowly, gradually increased it, and eventually she went from 38 seconds once to 3 times a week at 35 minutes, which was pretty impressive. But we've seen this time and time again with mitochondrial patients who have VO2 max, which is your maximal oxygen consumption, which is in their boots, eventually tolerate exercise, but you got to start slow, and everyone is different. So if one person tells you you've got to go 30 minutes or 20 minutes and they give you some hard rules, don't listen to them, listen to your body, start slow and gradually ramp it up. And you can ramp it up a number of ways. You can either increase the duration or turn that little dial there. You can see it here, which cranks up the tension. Use a combination of going a little bit longer and then maybe making it a little bit more intense. Most of you, should be using something other than just how you feel. And generally that's heart rate to monitor how you're doing. So I've got two devices. I don't know if you can see me. This is a Sunto watch. There's about 15 different watches that'll measure your heart rate. This is an Oura ring, which is another biosensor, which measures heart rate. And what you can do is take your age, and then you take 220 minus your age. That's your maximal heart rate. What you should be looking at is probably 60 to 70% of your maximal heart rate, not going above that. So it's a pretty easy calculation, easy thing to remember, so that you can look at your heart rate monitor and say, wow, I'm only at my resting heart rate. I'm not exercising hard enough, but you don't want to go, let's say 170 beats per minute, which is too hard. So it's nice to have something like a heart rate monitor to help you to judge the effort, but also listen to your body. If you can't talk, you're probably over 170 beats per minute, and that's too much for you. You should be able to converse with someone when you're exercising. And again, what we always recommend is focus on your greatest strengths. So we've had mitochondrial patients, for example, with Milas syndrome, who are very weak, but their endurance is not bad. And we've had other patients with Milas syndrome who are stronger than me, but their endurance is horrible. So whatever you feel is your strength, start with that. So for example, if your muscles are still quite strong, but you really run out of gas quickly, meaning your strength is good, but your endurance is down, start off with some more strength-based exercises, get used to it, and then titrate in or add in some endurance exercise. If you are super weak, you might want to start with very low intensity endurance exercise, get used to it, but even pedaling on a bike, you're actually building up a little bit of strength. And then after a few weeks, you can start adding a little bit of resistance, things like therabands or weights, which we'll talk about. So in general, what we like to do ultimately is combine resistance and endurance exercise. So start off with what you feel is your strength, add in what you're trying to work on, but ultimately, your goal would be to have some days where you do resistance, some days where you do endurance, or there's no problems if some of you want to do it all at once. Let's say Monday, Wednesday, Friday, warm up on an elliptical for 15 minutes, do some weights, some therabands, maybe a little bit of free weights, and then warm down on the elliptical would be a very acceptable way of doing it Monday, Wednesday, Friday. Other people, for example, might want to watch TV while you're spinning on a bike or doing an elliptical on Monday, Wednesday, Friday, and on Tuesday and Thursday, you might want to warm up a little bit and then do more of weights or therabands or something. The goal ultimately would be 30 minutes a day, a minimum of 3 days per week. We and Tanya Tavasalo and others have shown in secondary mitochondrial disease like myotonic dystrophy, in primary mitochondrial disease with both Milas syndrome and CPO, the two biggest groups, that this does work for folks, and most people can get up to 30 minutes a day. And ideally, it should be 5 times a week, but even 3 times a week will work for sure. I'd also recommend taking a day off so that your body can recover, because you'll find initially it probably takes more than 24 hours to recover. Whereas an able-bodied person can get ready for the next day. It might take you a day or two to get ready. And when we say moderate to vigorous, you should find that your heart rate's up, 60, 70% of your heart rate maximum, but don't push it to the point where you absolutely can't talk. That's a bit too vigorous. But if it's too easy and you're just spinning and your heart rate's 80, crank it up a little bit, either in duration or intensity. So again, you don't want to overdo it. Too many people, especially when you go with an able-bodied person who's already been working out, sometimes they push you a little too hard. Listen to yourself. And again, I think a heart rate monitor is a good thing to buy, and you can get a variety of different ones for a fairly inexpensive price. As low as $60, you can get a decent heart rate monitor, but also see how you feel. If you start to get hearing loss, if you're getting blurred vision, if you're getting palpitations, if you're getting chest pain, if you can't talk, then you're pushing too hard. So during exercise, look for those sort of things. But also the next day, if you're totally trashed, and you're really tired, give your body an extra day to recover. But eventually what you'll find is that that daily fatigue will slowly start to drop away as your body gets used to exercise. And again, don't push yourself to complete exhaustion. Another little tidbit too is we all get a little bit of discomfort in our muscles. That's normal. Don't freak out. It shouldn't be severe, so it generally shouldn't be more than like a 3 on 10 in terms of pain, but there will be a little bit of discomfort. You don't want to push to the point where your muscles are severely sore. And one of the other ways that dictates that you push too hard is if you ever get brown or dark urine, you've definitely pushed too hard. That's called rhabdomyolysis, and you should go to the emergency department because you might need some hydration. That's unlikely to occur if you listen to our advice. But we have seen some people who didn't know they had mitochondrial disease who were pushed too hard where that happened. Very rare side effect, but usually that's when you don't know you have the disease and someone pushes you too hard. It also is really good to exercise with a buddy, as we see here. And again, the buddy you want is someone who understands your disease and doesn't push you too hard. So start off with somebody who understands that you're going to listen to your body and you've got to adapt and take your time. So other things to remember too, again, if you've got a fever or a flu, not a good time to exercise. And this is a good rule for everyone because that puts stress already on your mitochondria. Most people are a bit dehydrated if they've got a fever or flu, and that can increase your risk for, even getting that rhabdomyolysis, because certain types of flu, including influenza, can cause damage to your muscle and you can get that breakdown. I would suggest avoiding extremes of heat and cold. So if it's 32 degrees and humid and you're used to exercising in 22-degree lovely weather, listen to your body because you are going to definitely not be able to do the same thing if it's 33 degrees and humid. And remember that humidity adds to heat, right? So 22 and humid is probably more challenging than 28 degrees and a dry temperature. So keep humidity in mind as well as heat, but by the same token, avoid, super cold days. One, hope, heaven forbid, you get out and the snow is bad and it's too cold and you end up with frostbite. That's not a good thing. But also when you get cold and you start shivering, that requires more energy and that's going to drain your energy system. So make sure you dress properly. Know what time of day is optimal for you. Again, for me, I love the morning because it's out of the way. I don't have to think about it. Wear proper footwear. So don't use, dress shoes or hard bottom shoes. Get yourself a good pair of shoes for both endurance activity, walking, cycling, whatever it might be, that fit comfortably. And there's lots of good shoes or shoe stores, I should say, around that sell good quality footwear. And again, know your equipment. So if you go to a gym, generally go with somebody that knows how to use the equipment, or there's often kinesiologists, personal trainers who can show you how to use the stuff safely, because you don't want to get your finger trapped in a weight machine. You don't want to fall off a bike. And there's a whole bunch of dangerous things that can happen if you don't know what you're doing. Turn a treadmill on. If you don't know what you're doing, you're going to fly out the back and break your head. So just know your equipment and be really careful and get instruction. A couple of things about nutrition. Generally for mitochondrial disease, I would recommend that you probably should have something to eat within 6 hours of activity. So if you are fasting from dinner at 6 o'clock the night before and you want to exercise in the morning, have a little bit of fluid at least with some carbohydrates in it. Just give yourself some energy. For other people, a light breakfast, and some people can exercise within an hour, 2 hours, 3 hours. But if you've been on an airline flight and you go to Europe and it's been 8 to 9 hours, you haven't eaten anything, plus you're under stress from the flight, listen to your body, have something to eat before you exercise. Generally, before exercise, you don't want to have a huge meal with lots of fat and protein and fiber because it's going to be in your gut and you're going to feel heavy. So generally a lighter breakfast or a lighter lunch if you're going to work out later on in the day, or a lighter dinner if you're going to work out in the evening is reasonable, because fat and protein can stay in your gut for up to 6 hours. Stay hydrated, of course, especially if it's really hot and humid, because humidity is a massive problem. Because as humans, we only get rid of our heat when we have the ability to sweat, and that sweat has to evaporate. It can't do that if it's humid. So be careful, and you can even use your water bottle to drop it over you to help dissipate some of the heat. what we find is to get ready for the next day, to replenish your muscles, try and eat something that has some protein and carbohydrates. And ideally, if you can get something in your body within 30 minutes of exercise, that's a good thing. And the reason for that is that when we exercise, our transporters to pull protein and to pull carbohydrates in go up to our muscle, and they're there for about 30 minutes after exercise. So for example, if you had, a protein bar with a fruit drink, would be an ideal thing afterwards. Chocolate milk's got good protein and some carbs, and that's when your body's primed to replenish for the next day's activities. So again, just to summarize, I'd like to go over everything twice. Listen to your body. That's probably the most important thing. Get to know your body, know what is good for you, what might be a bit too much. Take the time to rest and recover, especially if you push too hard and some people call it a mito episode, where, your vision might be blurry, your hearing might have decreased, your muscles are more sore. Take an extra day, let it recover. But eventually your threshold for those mito episodes is just going to be higher. Doesn't mean you'll never have them. Doesn't mean you can't push yourself too hard and get them. But if that threshold is higher, most often your day-to-day activity is not going to push you into one of those episodes. And that's the ultimate goal of exercise. Again, if you've had one, ease back into things, back off, and think to yourself, what happened? Why did that happen? Did I push too hard? Did I increase my intensity and my duration too rapidly? Did I not eat, or did I eat something that, maybe wasn't good for my stomach? There's a whole bunch of things, but reflect on what might have pushed you into that and ease off a little bit and think about it. Be patient. It does take time to get accustomed to exercise and get your strength back. So again, don't overdo it. The rare side effect is rhabdomyolysis. I hope none of you ever get it after listening to me, because you're going to heed all those cues and listen to your body so you don't push too hard and end up with what's called rhabdomyolysis, which is the breakdown of muscle, which then can eventually damage your kidneys. So again, brown urine, tea-colored urine, Coca-Cola colored urine, and sore muscles, that's a bad thing. That's rhabdomyolysis. Shouldn't happen, and your risk is lower if you exercise regularly. But if it does happen, get into emergency department. Again, if you're barfing and sick to your stomach and puking, vision loss, you've pushed too hard. So strength training, I'll just talk about a couple of features here. Weight training improves your strength and power, but in people who are impaired with muscular dystrophy or mitochondrial disease, it can improve your endurance. So we did a study in older adults twice where we did this, and we only did weight training. And what was interesting is that we almost doubled their mitochondrial capacity. In young people who are able-bodied and they lift weights, they mostly just increase strength, but not so much endurance. But in people with mitochondrial disease or muscular dystrophy or aging, when you do weight training, you also improve your endurance. Clearly, the power goes up. And people's ability to lift a weight goes up. So we have people, for example, we did what's called the 1 repetition maximum, which is as hard as you can get one up, and it's so heavy you can't do it a second time. After 3 months of resistance training in older adults who are super skinny and what we call sarcopenic, at the end of 3 months of training, that same weight that they could only lift once the first time, especially women, they could do it 30 times afterwards. So the point there is that when a given activity is easier for you, all the stuff around the house, like picking up groceries or taking something out of the back of the car, all of those things become easier because it's a relatively lesser proportion of your maximal power output. And so it just makes everything in life, all your daily activities, easier. In mitochondrial disease and aging, it turns on mitochondria. And there is some evidence that Tanya Tavasalo and Doug Turnbull showed that in the sporadic forms, which is mainly CPO patients, when you exercise, you actually remove some of the damaged mitochondria. I call it pruning the tree theory. And therefore, you remove some of the mutational burden. So you actually make the fundamental disease better. So we see that with aging, and we see that with CPEO patients mainly. So with weight training, again, it's a low number of higher intensity repetitions. In general, what we recommend is you should be shooting for 3 sets of generally 12 to 15 repetitions. What I mean by that is each set is I do, let's say, 12 repetitions of my bicep curls. Then I go and do leg press. Then I go and do like this lady showing with a resistance band. I go back to the original, which is my bicep curl. I do another 12 repetitions. I do 12 leg press. I do 12 of these resistance band pull-ups. Each one of those is a set. Now, when you first start, you may be only able to go through one set. That's fine. But your ultimate goal is 3 sets of 12 to 15 repetitions. And you can use anything for resistance. We use these TheraBands, and we've published a paper recently in 2019 with sarcopenic old people, where we show that only TheraBands led to increase in mitochondria, increase in strength, and increase in function. Going upstairs, getting out of a chair, all of those got better with just TheraBand-based exercises. Some people like weights, so these are called free weights. And again, you could pick different weights. So for example, for your arm curl, it might be 2 pounds. As you get better, you might go to 5 pounds. For the stronger individuals, it might be 10 pounds. And there's a variety of these available at many fitness stores that you can get anywhere from 1 pound all the way up to 25 pounds. And then other people might want to go to a gym where there's a machine. Again, get experience and coaching as to how to use the machines, but those are other things that people can use. So again, a variety of things, free weights, TheraBands. There's even things you can do against your own body weight, just getting in and out of a chair, for example. If you find that's hard, that's exercise for you. Get in and out of a chair, 10 times. That would be a good form of exercise. And there's a variety of things you can use. You can even improvise if you don't have money to buy kettlebells or free weights. You can just use a water bottle to do your curls. You can use a can of peas or corn, go from a smaller can to a bigger can. All of those are forms of resistance training. You can take a grocery bag and put 1, 2, or 3 cans in it and do strength training. So it needn't be expensive, just be creative. So aerobic exercise is the other general form. We've talked about the benefits before, improvements in lung health, heart health, improved delivery to the muscles. And most of this is by increasing the mitochondria in the muscles themselves. And this is your activities where it is a lower intensity contraction, but for longer duration. And in general, things like elliptical, biking, rowing, all of those are good examples. And we'll show you some here. So we've talked about the benefits. We went through this before, and I just want to highlight this thing here called VO2 max. That's your maximal oxygen consumption, which is the maximum amount of oxygen your body can extract. And this is usually very low in patients with mitochondrial disease. In fact, for many of our patients, it's so low that it's below the threshold that's been estimated for independent living. And our first study in MELAS patients, our average was about 8 mils per kilogram per minute. Sitting here, not moving, is 4 mils per kilogram per minute. So you can see that just getting up to brush your teeth is bringing people almost to their maximum. It would be like me going on a treadmill for 20 minutes at the maximal intensity. And what we want to do and what exercise does, it bumps up that VO2 max so that you're not taxing as much of it. And anytime you can exercise or do activities at a lower fraction of your VO2 max, the better off you're going to be. We did muscle biopsies and arterial venous catheters in people training, and we clearly showed that the amount of lactate that your body produces goes down when you train. And as you know, lactic acid is one of the canonical features of mitochondrial disease. Essentially, it's like the smoke from a fire that's not burning well, and you're cranking too much energy through that inefficient glycolysis. But with exercise training, more of the precursor to lactate called pyruvate goes into the mitochondria, and you have less lactate kicking around. So again, we talked about how to prime yourself for success. Again, you're looking for that sort of here we have 10, but I think it's probably safer 12 to 15 reps. If you can only do 8 reps, it's too heavy. If you can only do 20, it's too light. Sometimes exercising in a mirror, making sure that your technique is good, using proper footwear. This person isn't listening to me. Look at that, bare feet. And again, bare feet are probably not the best, because if there's some sweat in your feet or you slip and fall, that's not a good thing. So wear good quality shoes. And again, for resistance exercise, again, 3 times a week would be ideal. Even 2 times a week is fine if you can do that. 20 to 30 minutes. We usually like to warm up first, do the major muscle groups, and we've talked about that 3-set thing. Endurance exercise, anything that you enjoy is the right exercise for you. So find what you like. Every human being is an athlete. It's like kids, give them a smorgasbord of activity and they'll migrate to what they enjoy. So whatever it is that gets you, out doing the activity is the right activity. You're all welcome to start with some of these exercises. Again, more exercise, balance exercises. Some mitochondrial diseases lead to balance problems. So with balance issues, you can improve, but you got to do balance specific activities. But with the balance exercises, start off safely. So if you have ataxia, which can happen with certain mitochondrial diseases, which really just means you've got balance issues, hold on to something when you're trying to do the activities. And things like yoga, Pilates, dance, all of those things are good balance exercises. And there's a variety of them on the web that you can find, but just be careful, because if you're off balance, if you try something too difficult like this elephant here, you're going to hurt yourself. So hold on, get used to it, take your time, and make sure you're in a safe environment. So if you're going to do balance exercises, don't have sharp coffee tables nearby with a glass coffee table, for example. Be smart about it. Make sure it's a nice, safe environment when you're going to start these activities. And again, we've got a few of them. You can see here, this person's holding on. Don't start anything until you're accustomed to the activity by holding on. So have a chair or something like this. And do it first holding on to a chair. Ultimately, as you get better, you can let go of the chair. And in kids too, I guess this holds for adults too, is make it fun, because we're kids at heart too, all of us. We like things that we enjoy. And if you're told to do something that you absolutely hate, it's not the right thing for you. So for kids in particular, getting a dog is a great thing. There's even studies that show that people that own dogs have lower mortality, lower cardiovascular issues, because dogs force you to get out and walk. This is my daughter, actually, when she was a little rodent. She's now walking from Mexico to Canada, 2 weeks in, but this is her doing a form of resistance exercise. I mean, she didn't know she was doing that. She's playing, but again, if you make it fun, kids will do it. And it's the same for adults too. And again, tips for staying on track. We've talked about this before: buddy system, rewards, scheduling things, and try and get into that 3 times a week. Ideally 5 times, but if you only go 3 times, no big deal. Anything's better than nothing. And remember too, it takes a while. Again, make it fun. We talked about this before. Best exercise for anyone is the ones that you'll actually do, right?
That's great. That was a sprint finish. I think that's what they call.
Well, people don't want to listen to the same thing twice, even though it's going to jam it into your head. Let's answer your questions.
One of the questions here is, how much protein and carbs should we aim for 30 minutes after activity?
So protein should be 20 grams of protein. And if you look on any food packages in Canada, you can see how many grams of protein are there. And it depends. You don't just buy food. Can be a sandwich, a number of different things. You can go on Canada's Food Guide, and there's various other diet analyses programs on the web where you can figure out the content of different foods. But bars are convenient. That's the one thing that's good about bars, is that it tells you exactly how much protein is there, and you can get stuff from Costco, which is good price for various bars if you like that. Chocolate milk, just read on the back of it or look it up on the web. It can tell you how many grams. I think it's 8 grams for 250 ml chocolate milk. So a 500 of chocolate milk, boom, you've got your good quality protein. The other thing with protein is it's not just the total grams. 20 grams is a good round number, but it's the quality. So you get higher quality from fish, meat, eggs, and milk. Those are your highest. Eggs and milk are number 1. And next would be meats and fish. But you can also get protein powders, for example, which are usually derived from milk. So whey and casein are your milk-derived proteins. Those are far superior to collagen. And then carbs, generally 30 to 40 grams would be recommended. Now the protein is probably overall more important. The total daily protein intake that people should be taking in for mitochondrial disease and muscular dystrophy is at least 1.2 grams of protein per kilogram per day.
Okay, perfect. How do you measure max VO2?
Yeah, so VO2 max, we measure either with a bike or a treadmill. What we do is we put a machine into the mouth that measures the gas. So what we do is our air contains 20.93% oxygen. When we breathe it in, we utilize the oxygen and then we breathe it out. The difference between the oxygen concentration of what we breathe in and what we breathe out is the oxygen difference, and we have to multiply that by the volume. So when we do that, we get the volume of oxygen that is consumed per minute. So at rest, we consume 3.5 to 4 milliliters of oxygen per kilogram per minute. Top sport endurance athletes consume up to 92 milliliters of oxygen per kilogram per minute. Mitochondrial patients with MELAS syndrome are under 10 mils per kilogram per minute for ones who are quite symptomatic. That is a profound reduction, but that can improve, and it has been shown to improve by studies in Denmark and studies in Texas and studies in Montreal and England in patients with mitochondrial disease. And myotonic dystrophy type 1, our paper that we just showed that one of the biggest issues for those patients is mitochondrial dysfunction, and their VO2 max went up 31% after 3 months of exercise, very similar to primary mitochondrial disease. Yeah, so that's what VO2 is.
Okay, great, thanks. For somebody who's working with patients who have mito, saying it's difficult to get them motivated to get moving, is it better to perhaps suggest that they focus on heart rate rather than on time for exercise?
Yeah, I mean, it's a tough question because heart rate, I mean, okay, I can go up and do this and my heart rate goes up. Okay, that's done. I've exercised, you know, that's the extreme of, you can just focus on heart rate. I mean, heart rate, I think, is just a good way for people to not exercise too much and to exercise enough. So I think for every one of you, 220 minus your age is your max heart rate. Multiply that by 0.6 or 0.7. That's your kind of range that you'd like to exercise in. That's always a reasonable place to start. You're going to feel it where you can get through 3 or 4 words, but you can't get a full sentence out. That's about as hard as you want to go. But you also want to feel that you're starting to sweat and that you're actually working out. So generally your heart rate for an average middle-aged person is going to be over 100. But certainly less than 150 would be a reasonable range. But again, it's a tough one just to focus on that. I think if people just do something, get out, try and get to 30 minutes 3 times a week with something you enjoy, you're going to be better off than if you don't exercise. And then all the nuances with specific heart rate, you can split hairs with those sort of things with a personal trainer. Or a kinesiologist or a physiotherapist to really hone in if you're interested. But I think for everyone, don't be afraid of it. Just get out there, follow the rules, and enjoy yourself, and you'll do much better.
Okay, that's great. Wonderful. Thank you. So we have a question here for someone who has children who have mitochondrial dysfunction with complex medical conditions and no independent mobility. What do you suggest for increasing exercise for that group?
Yeah, so no independent mobility is a tough one. I assume obviously that they're wheelchair bound, and therefore you've got just arm function, for example. But even any movement's good movement, I think, is a good rule. So in our boys with Duchenne dystrophy and our boys and girls with spinal muscular atrophy who have severe weakness, for example, and I see tons of these folks every week. And all they can do is move their arms. Even for those folks, we do give them therabands, and they do stuff with the arm. Things like reaching to play games on the computer. For example, if there's some sort of a game where you have to touch stuff, just doing this, I don't know if you can see me, but doing this is exercise. All right. So if there's a game you can set up for them where they have to reach up a little higher than they normally would to touch something to get some sort of a feedback to make it a game, that's exercise. So anytime you move a muscle, it's good for the muscle. It also is good for the joints, because if you don't move, you end up with contractures, and that's not a good thing for people to get contractures. So any movement's good movement, but you may have to be creative. But also people in a wheelchair too, make sure you're doing stretches as well so that the people don't end up with contractures at the joints. Okay,
perfect. So 2 quick questions. One is, if I do exercise in the upper body, does it benefit lower body as well?
Yeah, that's a good point. Like I say, any exercise is good exercise. One of the things that we do know is that you can do upper extremity exercise, increase your heart rate. So you're going to get all those cardiovascular benefits. the benefits to your mood, to the brain, and all of that good stuff is going to happen. And even to the lower body, there's some crosstalk. Obviously, the muscle that you actually move is the one that's going to drive most benefits, but it's still good for the whole body to exercise.
Okay, great. Lactic acid. Can you just really quickly explain what that is and how it's significant for people with mito?
Right. So our body can burn fats, proteins, and sugars. Sugar is the main thing that we burn, except for prolonged fasting. But let's say we took in some sugar. Sugar is transported into muscle through things like GLUT4, which is a sugar transporter. The sugar then is brought through a process called glycolysis. Glycolysis is called splitting of glucose, or that's where the name comes from. So either the sugar that we eat, or when we eat sugar and we sit around after a meal, it gets stored as a starch in our muscle called glycogen. Those are the two sources of this glucose, which goes through this pathway. So it's called glucose splitting. So that is the inefficient pathway that we first had 1.5 billion years ago. And then it gets cranked out to lactate. To go through that pathway, we get a tiny amount of energy. The more efficient pathway is to go down to what's called pyruvate. And instead of making lactate, which is inefficient, you go into what's called the TCA cycle, which ultimately is part of the mitochondria. And that's a very efficient pathway. So what you can understand is that if the mitochondria don't work, the only thing you can do, it's very inefficient, called glycolysis, which makes lactic acid. So the lactate coming out in our blood is a reflection of mitochondria not working very well. So when we exercise, for any unit of activity, more of the energy is going into muscle, so less gets cranked out into making lactic acid. So when you're more fit and you're healthier, your baseline lactate should come down. And for any given amount of activity, the amount of lactate you generate will come down as well. And so therefore, lower lactate is reflective of improved mitochondrial health. And that's why we use lactate when we see a patient who comes to us with seizures or whatever, and we start thinking that they might have mitochondrial disease because we measure lactate. And if it's up, we say, I bet that mitochondria is not working very well. Let's find out if they have mitochondrial disease. Final thing, I just wanted also to thank Louise Gibson for this. I've gone training with Louise last year and the year before, and I think even the year before that. And we did, I think, 2K. So anyone who thinks you can do activity, just look at how amazing she is, and just to watch her go out and hammer for 2K, it was unbelievable. And you can really see too, just in terms of her fitness improving, and she started slow. It's really impressive, and I think something we all can look towards for an ideal example of someone with mitochondrial disease who really doing a fantastic job. So thanks so much for the support, Louise.
Thank you so much, Dr. Charnopolsky, for sharing your insights with us. And that will conclude our session. Take care.
Thanks. Bye-bye.